Assalamualaikum and good morning to everyone who is joining us today. Welcome to all school students, teachers, parents from all around Malaysia, not forgetting all UMS students and staff present in this webinar session. Thank you, and we meet again for today's sessions of STEM Speaker Series. STEM Speaker Series is a collaboration between U Science UMS and my STEM Ambassador UMS. My name is Edda Shawati binti Dakim. I am from U Science UMS, will be in charge as moderator for the session. For those who join us for the first time, this STEM Speaker Series is a co-joint effort with Faculty of Medicine and Health Science UMS. This program is fully supported by the Sabah Ministry of Science, Technology and Innovation, aimed to deliver unique and interesting STEM topics designed by subject matter experts to increase the interest of school students, teachers, and community alike to venture in the fields of STEM. For any questions from the audience, please feel free to drop your question on the chat box at the right side of this YouTube live session. Please be informed that for today's session, e-certificate will be given to school students and UMS students. Therefore, I would like to everyone to stay tuned with us to fill the form given through link that will be shared at the end of the session. I would like to introduce our speaker. With us today is Associate Professor Dr. Nornazirah Azizan from Faculty of Medicine and Health Science UMS. Prof. Nornazirah is a senior lecturer and anatomic pathologist. She has received her education in Doctor of Pathology, Anatomic Pathology from University Kebangsaan Malaysia, Ceras, KL, and MD from University Malaysia, Sabah. She has received Q1 Journal Publication Award, Journal Publication Award 2018, Publication Award, Appreciation Night 2018 from Faculty of Medicine and Health Science UMS, and also Anugerah Perkhidmatan Cemerlang APC 2017. She also has many publications, including a case report regarding primary prostatic signet ring cell carcinoma in elderly with obstructive uropathy. Her ongoing research is production of tyrosinase from Sabah edible wild mushroom for application on melanogenesis and phenol decontamination. So, without further ado, please welcome Prof. Nornazirah with her topic entitled Cancer Prevention. Prof, please be invited.
Okay, Bismillahirrahmanirrahim. Thank you very much, Ms. Erda, for the very kind introduction. Assalamualaikum warahmatullahi wabarakatuh, and very good morning. I am Associate Professor Dr. Nornazirah binti Azizan from Fakulti of Medicine and Health Sciences. So for today, I'm going to share with you regarding cancer prevention. Okay, so what's important about cancer? I think everyone know. Without further ado, we'll start. Sorry, before I start, thank you very much for the audience as well. As what Miss Erda said, we welcome you all, okay, to gain as much as possible in this sharing session. In case you have any question, please feel free, okay, to drop your question in the chat box. So for today, the topic that I would like to share is cancer prevention. Okay, before I start my presentation, the word cancer itself, actually, I think it's related to STEM, because it's one of the, there's a lot of scientific things that we can discover and has discovered or has not been discovered from this cancer. Means there are various type of cancer. So for today, we'll focus on the prevention part. Okay, in order to prevent cancer, at least the public have to be aware of what is cancer and what are the sign and symptom of cancer, means the tanda-tanda, okay, cancer, as well as the behavior and then the what we call as what are the modalities, okay, that are available for cancer prevention. Okay, let me share, okay, my slide for today. Okay, I have a lot of slide, but mainly photograph. Okay, I hope this will can gain your attention. So the aim is for early detection. So when early detection of cancer will be able to help, okay, the cancer patient, to save their life. Cancer situation worldwide is still a major problem worldwide, as reported by WHO. Okay, the latest is 2012. Actually, every 5 years they will come out with a new cohort of statistic, but for this year 2022, it's still undergoing. We haven't published yet. So for latest, it's still about 40 million of new cancer incident every year worldwide, and it's bring up to 8.2 million of mortality. Okay, so more than half of it lead to mortality, means leading to kematian, to death. Cancer situation in Malaysia. How about in Malaysia? Okay, in Malaysia, it's still a 10 principal causes of national mortality. Means it is still under the 10 principal cause of death in Malaysia. Okay, it around the third. In the third place. The first one is still respiratory problem, especially during the COVID pandemic. Respiratory problem cause increase the number of mortality, the death. Actually cancer is number 3, the third place. Okay, in 2015 itself, it was about 13.6% of all death in Ministry of Health, as compared to previously only 8.6 in 1996. So we can see the increment in terms of percentage. So cancer death in Malaysia, basically you can see the trend from this table here. Okay, so you can see the trend. It's increasing in trend in terms of the number as well as the percentage. Okay, so the incidence of the 10 most common cancers in Malaysia. You can see from last 5 years cohort, breast is still number 1. Okay, still number 1, breast, and followed by colorectal. Colorectal is gastrointestinal tract. Okay, the large bowel, usus besar, and then followed by the lung, lymphoma, blood cancer. Okay, nasopharynx, the nose, leukemia, blood cancer, prostate gland for the man, liver, cervical, and ovary. Okay, so as you can see here, colorectal cancer and then lung. This is among males. Most common among males are colorectal cancer. Okay, colorectal means usus besar. Okay, the lung, and as well as prostate. Prostate also increasing in trend. For women, for females, mainly is breast, still followed by colorectal, okay, and then lung. Cervix, we can see the number is, I can say it's increasing in trend, but in terms of the total number, it's still around number, it's number 5, okay. It's still considered as we are able to control. Why? I will explain later. Okay, this is considered a good sign. Okay, so before I go to specific type of cancer, I would like to share what are the general risk factors for cancer. Okay, we have a modifiable risk factor, okay, and non-modifiable. What is risk factor? Risk factor basically is a factor risiko. So means those who have this, the factors that I'm going to explain, I'm going to share later, means they are at risk of getting cancer. Not necessarily they will get cancer, okay, but they are at risk of getting cancer. So we have modifiable that we can modify, actually, we can control, and non-modifiable. Non-modifiable, we cannot control, but if let's say we have this non-modifiable risk factor, we have to be aware and go for screening. Okay, so non-modifiable family history. Okay, if we have any of us have family history of malignancy, we are at risk of getting the same type of cancer. Okay, so better be aware and get early medical checkup, get surveillance done. Okay, age. Okay, by aging, we cannot control this aging process. Okay, it's normal. It's normal. However, by increasing age, the risk of getting cancer is higher. Okay, gender. Okay, so being a male cannot still have a risk of having prostate cancer, for example, and then being a female, you cannot run away from having a risk of getting breast cancer. Okay. Modifiable risk factor. These are the things that we can actually modify and try to control the lifestyle. First and foremost is smoking. Okay, smoking can lead to many diseases. Okay, cancer, cardiovascular, the heart problem, respiratory problem. Okay, alcohol may lead to liver cancer. Okay, obesity. Okay, obesity. This is one of the major problem basically that we can actually prevent. Okay, this obesity may lead to various type of cancer. Okay, now we go to a specific cancer type, which is first and foremost is cervical cancer. Even though it's not as much as breast or any other colorectal or lung cancer, but it's still considered a major problem, okay, in Malaysia. And furthermore, we have a very good preventive measure for this cervical cancer, in which for cervical cancer, we actually can prevent it, okay, by early detection. So we can get the patient to be fed and get early treatment, okay, to prevent mortality, to prevent death from cervical cancer. Okay, cervical cancer incident in Malaysia is about almost 4,000 new cases every year. It's a third leading cause of female cancer in Malaysia, but after now it's become the fourth lah actually, after lung, colorectal and breast. It can occur as early as 15 years of age until menopausal age. Basically, okay. Why 15 years of age? Basically, the moment cervical cancer ni actually it's transmitted by one virus, okay, which actually it caused by a virus which is transmitted through a sexual intercourse, sexual activity. So the moment have sexual intercourse means the person actually is at risk of getting this HPV. That's why better to get pap smear done. Okay, so cervical cancer is a malignant tumor arising from the cervix epithelium. Cervix, in a layman term, we call it as pangkal rahim. Okay, so in this cervix we have a transformation zone. Okay, so the precancerous lesion usually occur at this transformation zone. Our aim is actually to detect this pre-cancer lesion, okay, as early as pre-cancer. So dia belum lagi jadi cancer, so we want to actually remove it, okay, to prevent from cancer to happening. Okay, this is the cervix. If let's say from down here, from the we can see the cervix is like this. It's actually pangkal rahim. So we have this bukaan pangkal rahim here. This is the os, the opening here. This is the area that usually the lesion can occur here at the central part. Okay, the opening. So the etiology means a cause. Okay, so the etiology is actually caused by this very tiny virus. Okay, this virus is we can say it's so powerful, can cause cancer. Okay, so this is a human papilloma virus. We have a specific type of human papilloma virus that can cause cancer, which is type 16 and 18. This is considered a high risk type. So this HPV is actually it's a culprit lah, a cause of cervical cancer. We have various other types of HPV, okay, such as HPV 6, 11. This can cause a wart, but 16 and 18 can cause a cervical cancer. Okay, what are the risk factor? In order to avoid, we have to know the risk factor, so we can avoid this risk factor. First is early age at first sexual intercourse. Let's say less than 17 years of age. Okay, the moment we have exposure to sexual intercourse, we are at risk of getting HPV virus. But that's why I have to maintain healthy, okay, sexual activities. Okay, early age at first intercourse, okay, with multiple sexual partner, especially if let's say more than 3 partners, okay, even at higher risk of getting this human papillomavirus infection, or the male partner have multiple other sexual partners, okay, so also at risk of getting this HPV infection, okay. Or the person have history of, sorry for the term, high seal. Okay, high seals mean the pre-cancer lesion. If let's say they have history of pre-cancer lesion, it may take 3 to 5 years for this pre-cancer lesion. Okay, this is the pre-cancer lesion. Okay, so this is the cells. Okay, the cells on top of our pangkal rahim, okay, of our cervix. As long if let's say it become a lesion, okay, it get infected by human papilloma virus, it may take 3 to 5 years to become cancer. Okay, for these cells to invade, okay, the beneath the underlying tissue. So it takes 3 to 5 years. So we have time to actually remove this pre-cancer lesion. Okay, we have enough time to remove this pre-cancer lesion as long as we detect it early. Okay, that's why early detection is very important. If let's say someone have this the above risk factor, okay, please, okay, go for checkup. Okay. Furthermore, if let's say have this sign and symptom, it's even more suggestive of cancer. You have to go to we have to go to the hospital as soon as possible. If let's say have abnormal vaginal bleeding, okay, means beyond our normal menses, and then contact bleeding or postcoital bleed. What is postcoital bleed? Means bleeding post sexual intercourse, after sexual intercourse. Okay, increased vaginal discharge, okay, abnormal vaginal discharge, or having dyspareunia or pain during sexual intercourse. Let's say having pain during sexual intercourse or after sexual intercourse having bleeding or any abnormal bleeding, or abnormal discharge or unexplained and persistent pelvic pain at the pelvic area, please come forward to a hospital. Okay, however, the small tumor and precancer lesion usually will not give this kind of sign symptom. Okay, the moment someone have this kind of symptom, it's highly likely to have cancer. Okay, that's why early screening is very important. How to prevent? Okay, first, healthy lifestyle. Okay, avoid multiple sexual partner, avoid sexual intercourse at very early age. Quit smoking. Okay, and if let's say those who have actually exposed to sexual intercourse, okay, can go for pap smear screening test. Okay, and this pap smear screening test is done to those who already have exposure to sexual intercourse. However, we have another modality of prevention, which is now HPV vaccination. Okay, vaccine. Okay. So I think for secondary school student, they know, I think this HPV vaccination program has been ongoing, especially to the, I think, Form 3 student. Okay, so National Cervical Cancer Prevention Program, the aim is to stop cancer. This is considered as a primary prevention. Okay, HPV vaccination with healthy lifestyle is considered as primary prevention. Maksudnya dari awal lagi we would like to prevent even before dia ada exposure to sexual intercourse or before dia ada exposure to this human papillomavirus, we give vaccination against this human papillomavirus. Okay, so it has been introduced in 2010 as a national program. Its targeted group are adolescent, Form 1, okay, 13 years, and then it's specific to target type 16 and type 18 human papillomavirus. Okay, I think most of us are quite familiar with virus, okay, due to COVID, thanks to COVID. So COVID pun you know about vaccine, so COVID pun ada different variant, Delta lah, Omicron lah, so we target specific to those virus. Same goes to HPV, we target to type 16 and 18 to prevent cervical cancer. And then how about secondary prevention? Secondary prevention basically pap smear lah. I think some of you might know what is pap smear. Pap smear, we take some sample from the cervix, okay, from the pangkal rahim that I mentioned just now, to detect if there either there are actually presence of precancerous or pre-invasive lesion or not. Okay, if let's say no, okay, we repeat after 1 year. If let's say 2 consecutive pap smear are negative, so we can repeat every 3 years after that. Okay, if let's say positive, then we have to treat accordingly to prevent it from become cancer. Okay, as I mentioned, policy between 20 to 65 years of age. Why after 65 we don't do pap smear anymore? Okay, because the risk of getting cervical cancer after menopause is very, very low. Okay, or those who are sexually active or has been sexually active before. Usually every year, okay, for the first 2 years, if let's say normal for the first 2 years, and then we go for every 3 years. If abnormal, then we will treat by a case basis. Where we can do this pap smear, can go to either government or private clinic or hospital or university hospital, okay, even under HUMS, under our pusat rawatan also we have these facilities, or LPPKN. LPPKN, if let's say in Kota Kinabalu, it's in Harrington, next to Klinik Kesihatan Harrington, okay. So they also provide this kind of services. Okay, now we go to breast cancer. Okay, don't worry. First, focus on female cancer, but I will touch on male cancer as well after this. Okay, the colorectal as well as prostate cancer. Okay, so breast cancer. Breast cancer is the commonest cancer among all, especially among female. Okay, so I think everyone know. Okay, famous I think Angelina Jolie actor. Okay, so why I put up this photo, because I think everyone know in the news. Okay, she actually has detected to have a gene for carrying breast cancer gene, which is a BRCA gene, okay, from the family. So to prevent, since she know that she have a cancer, it's not having a cancer. Okay, she know that she have the gene that can, so she actually have a high risk of getting breast cancer. So she get both breast removed and transplant. Okay. So as an introduction, and this is a major health problem. Okay, this is the most common cancer in among all women in all ethnic groups. Okay, it occur around, okay, as compared to cervical just now, it's about 4,000 new cases kan. Tapi for breast is about 21,000 plus new case every year. Okay, new case for the 5 years cohort. So it's around 34.1 thousand of the total number of all new cancer cases. So it's why we actually promote prevention of breast cancer, because it has a good chance if being diagnosed early. Same goes to cervix. If let's say we can detect the pre-malignant, pre-cancer lesion, we will be able, the person will be able to get the best treatment to prevent from cancer to happen. Same goes to breast cancer. If let's say diagnosed early at early stage, okay, actually it can be cured. Okay, so percentage mainly in stage 2 lah. Okay, it's good to see this table stage 2. However, still quite a number of stage 4. Stage 4 means dah max dah go to other organ other than breast. Means the cancer go to the lung, liver. So it's quite high. Okay, here still worrying. Okay, age-specific cancer incident usually it can occur as early as teenagers, but the peak age, the commonest is around 60 years of age lah. Okay, 50 to 60. Okay. Okay, what are the risk factor? Okay, as I mentioned, in order to prevent, we have to know the risk factor. What are the risk factor? Being a female. Okay, being a female is a risk factor. This is non-modifiable. We cannot modify our gender. Regardless we go for plastic surgery or whatsoever, still the nature is being a female. Okay, so female have a 99% chance of getting breast cancer as compared to male. Males still have 1% chance of getting breast cancer. We have a few cases of male breast cancer as well. Okay, so there are several cases being reported, being published in the journal, male breast cancer. So even recently in Hospital Queen Elizabeth also we have, recently we diagnosed one male patient with breast cancer. Very unfortunate. Okay, the other risk factor, if let's say the person taking oral contraceptive pills, the hormone, oral contraceptive pills for more than 10 years, if let's say prolonged exposure to estrogen, so if a risk of getting breast cancer. Okay, this is kata apa device actually trying device to prevent pregnancy. This one we have two type. Okay, trying device we have two type. One is coated with hormone, one is not coated. So this one is coated with hormone. If let's say coated with hormone means we are at risk of getting breast cancer because have exposure to estrogen. Okay, what is this? First full-term pregnancy after 30 years old. Means first pregnant after 30. Maksudnya lambat pregnant. Okay, first pregnancy lambat. Okay, why? I will explain later. Okay, this lambat pregnant ataupun early menarche, late menopause. What is early menarche? Early menarche means starting the menses, okay, the age of the first menses. Menopause means dah complete menses, no more menses. So if let's say the woman have, the moment they attain menarche, the moment they start menses, means dia dah ada exposure to estrogen. Okay, the moment we have our first menses, means estrogen dah start being produced. So we have exposure to estrogen. If let's say the person have early menarche, okay, awal first menses, okay, maybe at the age of 9 years old, for example, but late menopause at the age of 65. So the duration of exposure to this estrogen hormone is longer as compared to those yang can first menses at the age of 15, but menopause at the age of 60, for example, or 55. So we can say the duration is longer, okay, to those yang early menarche and late menopause. So that's why the culprit, so I can say here in a, I don't know whether it's but in a layman term, I can say the culprit for this breast cancer basically is estrogen hormone. Okay, so if let's say we are on hormone supplement ataupun early menarche, late menopause ataupun lambat getting pregnant or not pregnant at all. Okay, nulliparity means not pregnant at all. Because why? If let's say pregnant, we are free from this estrogen hormone for the period of 9 months at least. Okay, so we can be relieved. So kita tak ada menses for the period of 9 months. So at least ada free of estrogen for 9-month period. So kita rest from estrogen. So that's why if let's say nulliparity ataupun lambat pregnant, means the exposure to estrogen is longer lah. Okay, the duration of estrogen exposure. Or dense breast. Why dense breast is one of the risk factor? Because once, if let's say someone with a dense breast, very difficult to detect early lesion. Okay, family history, as I mentioned, if let's say family history, especially first degree family history. What is first degree family history? Means with a mother or sibling, okay, or the other females or the other sibling have breast cancer, so we are at higher risk of getting breast cancer. Okay, what are the signs, symptom? Apa tanda-tanda of breast cancer? Okay, from this one tray of lemon, okay, imagine this lemon is a breast. Okay, first we can see a thick mass. Okay, this is the nipple lah. Okay, thick mass or ada indentation termasuk ke dalam, or skin erosion, nampak ada skin lesion, or redness, or heat, panas ataupun kemerah-merahan, or ada fluid discharge from the nipple. Okay, this actually or skin dimpling, skin macam tercucuk-cucuk masuk ke dalam, or ada visible vein, blood vessels, visible blood vessels, or ada bump or lump, or the nipple is retracted inside, or ada new shape or size, okay, of a nipple or of a breast, and the skin looks like an orange peel. So these are the sign and symptom of breast cancer. Okay, and the actually the thing is, we would like to detect early of invisible lah. Before all these sign and symptom, we would like to detect early. How are we going to detect? Okay, because early detection basically save life. So how are we going to detect this invisible lump? There are several methods. Okay. This one is skin dimpling lah. Okay, this is the breast of skin dimpling. Okay, so this one is retracted nipple. Okay, changes in the size and shape of the breast. Okay, and it's asymmetrical. Okay, this one. Okay, further close up. Okay, this is breast cancer cases. This is the blood stain discharge from nipple. Okay, this one is visible lump. This one at least considered as stage 3 because it's already involved the overlying skin. Okay, screening and surveillance. This is what I would like to emphasize today. So breast self-examination. Okay, our aim is to detect as early as possible, so we will be able to give treatment. So breast self-examination is very effective in reducing breast cancer mortality, means breast cancer death. So the effectiveness of breast self-examination ni, dia punya, our hand ni actually as sensitive as doctor's hand. Okay, believe in the power of our hand. So do your own breast self-examination, because usually those yang kata datang, doktor, I have detected some lump during my breast self-examination. Usually, yes, there is a lump. Okay, unless it's an incorrect technique, and then it's you should, if let's say but still okay, if let's say you detect any lump or you feel something different with the breast, please come forward to clinic. Don't be afraid. Okay, then we have other modalities of mammogram. Okay, mammogram, especially this mammogram is very good in detecting very early lesion in asymptomatic individual, the impalpable tumor. Okay, the mass yang very small, belum lagi kita dapat palpate, belum dapat rasa. Mammogram will be able to detect it. Okay, usually for women at high risk of breast cancer, we suggest to go for screening as early as 30 years old. What are who are actually at high risk? Those with first degree family history, especially, ataupun yang ada BRCA gene. Okay. So mammography, MRI, and ultrasounds are the modalities that can be used for screening. Okay, breast self-examination, how to do it? First, okay, step 1, raise your arm. Okay, let's say you want to examine the left breast first, raise the left arm up first. Okay, and then use the right hand to examine the left breast. Okay, please use the palm. Okay, don't squeeze. If let's say you squeeze, definitely we will feel some lump and bump because the nature of breast is lumpy. So press. Okay, if let's say press, and then you will be able to detect a true lump. Okay, and then repeat on the other breast. Move. Make sure cover the entire breast area. Okay, and then look if there is any change in the size or shape, any redness or any fluid discharge or blood discharge from the nipple, okay, swelling in the armpit, or lump or thickening, okay, or change in the skin texture or pain. Okay. Okay, this is how to do a breast self-examination. As I mentioned just now, please use your palm. Okay, then you can go either up and down, wedges or circle. It's okay as long as cover the whole breast as well as the armpit. Okay, what are the imaging modalities? We have ultrasound, mammogram. Okay, ultrasound is the same as ultrasound for antenatal. Untuk pregnancy, we scan. Okay, it is painless, definitely. Okay, and then mammogram, this is how we do mammogram. Mammogram is, I can say, it's not painful, but will give some compression to the breast, okay, in order to shoot the X-ray and the X-ray. Okay, and then cytology is another modalities. Okay, we use a fine needle to get some cells. Okay, if there is a tumor or a lesion, then only we'll do this. If not, we will not proceed with this cytology. Okay. Okay, I think it's clear for breast cancer. Okay, in case you have any question, please feel free to drop the question later. I think we proceed with colorectal cancer. So for colorectal cancer, this is a bit of anatomy and function of the bowel. Okay, so this is actually tumor of large bowel, usus besar. Okay, so or what we call as a colon. Okay, it consists of colon, rectum, and anus. Okay, so what are the signs and symptoms? How do patient with colorectal cancer present with? Usually, they will come as anemia, okay, with anemic symptom. Anemia means low hemoglobin level, kurang darah, pucat. Okay, so nampak pucat, so anemia. Or they can come with abdominal pain or the perianal symptom, like rectal bleeding, means bleeding after when passing out motion, with loss of weight, loss of appetite. Okay, if let's say unexplained loss of weight and loss of appetite, tiba-tiba tak lalu makan, tiba-tiba berat drop from 10 kg to 5 kg within 1 month, okay, without not on diet, okay, not on heavy exercise. Okay, so this is alarming sign for any cancer, basically loss of appetite and loss of weight. Tenesmus. Tenesmus means feel like incomplete emptying of the bowel. Okay, rasa macam bila buang air besar tak habis. Okay, and then ada mucoid, feces or constipation. Okay, alarming presentation, basically if let's say have fresh blood or blood mixed with stool, altered bowel habit with significant weight loss. Altered bowel habit means usually you pass motion every day and suddenly unable to pass motion for 3 days, for example, or suddenly having diarrhea. So it means considered it's altered bowel habit, means change from the normal habit, and or unexplained anemia, pucat, and or palpable abdominal or rectal mass. Okay, ada rasa ada ketumbuhan, ada mass in the abdomen. So, okay, colorectal, second most common after breast. Okay, you can see stage 4 is still alarming. Okay, so we have the etiology can be non-modifiable or modifiable. As mentioned, family history is non-modifiable. This one, okay, cigarette smoking. Okay, smoking can cause many type of cancer, can cause Nasopharyngeal, hidung, mulut, nasopharynx, larynx, pundi kencing punya kanser, paru-paru, cervix, liver, hati, okay, gastric cancer, perut, esophageal cancer, buah pinggang, pancreas, usus, ovary, leukemia, any type of cancer, you name it. Okay, so this is actually, that's why, okay, Kementerian Kesihatan Malaysia, our Ministry of Health, actually to promote this no smoking. Okay, avoid smoking. Okay, risiko obesity, cancer usus, makan sausage. So this one is major problem. Okay, I think we cannot avoid, especially our youngsters, from taking sausages. Okay, so that's why now I think in most of the cafeteria they don't allow sausage anymore. Okay, especially at school. Okay, meat and cancer, how strong the evidence. Okay, meat basically group 2A lah, probably can cause cancer because red meat is one of the risk factor. Okay, food can say has actually a linkage. Okay, it's a risk factor of getting colon cancer, especially processed food. Processed food is got group 1. Okay, salami ke, bacon, sausages, hot dog, ataupun burger, processed meat, semua ni actually under group 1, highly likely to cause cancer. Kalau katakan fresh meat, pork, beef or lamb, red meat, in group 2A, probably, okay, causes cancer. So meat, try not to take too much. Okay, try to take more chicken or fish, okay, rather than red meat. Okay. Okay, surveillance. How do we do? If let's say symptomatic, contohnya ada anemia, ada bleeding, ada abdominal pain, okay, go and seek treatment as soon, as soon as possible. If let's say no family history, but age is already more than 50 years old, try to get your IFOBT done, the screening done. If let's say have family history, okay, usually we advise for colonoscopy, at the age of as early as 40 years of age. Okay. Okay, this is IFOBT, immunochemical fecal occult blood test. Kita nak determine before kita nampak blood in the stool, kita dah boleh detect blood. Okay, before it become visible, means as early as possible. This is how we do IFOBT. We take a stool sample, masukkan, goncang, and then drop here. Okay, it's like a COVID test jugalah. Okay. And then colonoscopy. Colonoscopy means we put a teropong inside. We can try to visualize the colon. Okay. Now we go to prostate cancer. I think the time is 9:48. We still have 10 minutes. 12 minutes. Okay. So for prostate cancer, cancer of male prostate. So female don't have prostate. So this is male cancer. Okay. Common among men after the age of 50. Okay, prostate is actually, prostate gland is located here beneath the bladder, okay, above the penis. Okay, it's surrounding the urethra. What is urethra? Urethra is saluran kencing. Okay, so as you can see, prostate gland actually is surrounding the urethra. Okay, surrounding the saluran kencing. So the moment something happen in the prostate gland, usually sama ada dia hyperplasia, means the enlargement of the prostate gland, ataupun prostate cancer, it may cause impingement of the urethra. So that's why it will block the urethra. That's why usually those male who has having prostate lesion, usually they will come with symptoms of unable to pass urine, pain during urination. Okay, so they pass urine mungkin sikit-sikit, so rasa incomplete emptying, increased frequency of urination. Okay, so it's the third leading cause of male cancer in Malaysia after colorectal cancer and lung cancer. This is the third leading cause of male cancer, about 4,000 plus cases. Okay, as it's almost similar as cervical cancer lah. 7 most common cancer among both genders in Malaysia. Okay. Okay. So risk factor, aging process, race usually among African American, family history, or exposure to herbicide and pesticide. Okay, this is another risk that we can avoid. Okay, what are the signs and symptoms? As I mentioned, frequent urination, weak or interrupted urine flow, or have blood in the seminal fluid every time ejaculation. Okay, need to strain. Okay, to empty the bladder, have blood in the urine, feel pain or burning sensation during urination, the urge to urinate or increase the frequency of urination, especially at night, and having erectile dysfunction. Okay. Method of screening. We have two methods of screening. Okay, we have the modality for early detection, which is a digital rectal examination. Every time when someone having this sign and symptom, ada frequent urination ke, okay, weak urine flow, okay, ataupun urgency, increased frequency of urination, they will come to clinic. So doctor will do a digital rectal examination. We will put one finger, okay, from the usus besar, from the anus, okay, to examine the prostate. And we can do a blood test, which is PSA. But this PSA is still controversial, okay, whether it need to be done, because PSA does not indicate cancer. Okay, anything happen to the prostate will cause increase in PSA level. Okay, how do we detect PSA? How do we measure PSA? Actually, from blood test. Okay, so PSA is not specific. It's not specific to cancer. It is sensitive. Okay, if let's say anything happen to prostate, even the non-cancerous lesion, also this PSA will raise. So it's controversial due to a risk of false positive result, means tak ada cancer tapi PSA is high. Okay, if let's say ada trauma ke, ada inflame ke, ada infection, everything will lead to raise in PSA. Okay, this will give a psychological implication lah. Okay, so this is digital rectal examination. Let's say prostate in enlarged, we will be able to feel it from the rectum, from the anus. Okay, that's all from my presentation today. If let's say having any symptom, have to come forward to the clinic for digital rectal examination by the doctors. Okay, that's all. Thank you very much.
Thank you very much, Prof. Nornazirah. It was a very interesting and wonderful topic and very well presented. We invite some questions to be answered by our speaker that was sent to us during the presentation. So the first question is from me, myself. I want to know, Prof, how often should we as a woman to do pap smear?
Okay, thank you for the question. Actually, for pap smear test, if let's say the moment we have, as I mentioned, the moment a woman have exposure to sexual intercourse, means they are a risk of getting human papillomavirus infection. So the moment those who are sexually active, or have been sexually active before, means pernah sexual intercourse, have to go for pap smear screening. So the first pap smear screening, you can go actually anytime, but avoid going during menses. Okay, make sure usually 10 days after menses baru pergilah, okay, to avoid so during bleeding please don't go for pap smear. Okay, the first pap smear test, if let's say negative, repeat it after 1 year. Okay, first repeat after 1 year. If let's say 2 times, okay, for this first 2 years both are negative, so the third pap smear when to repeat is after 3 years. So we do it every 3 years after that. If let's say the first 2 is negative. Okay.
Okay. Thank you, doctor, for answering the questions. So there will be no more questions from the audience. Thank you, Prof. Nornazirah. We hope the audience enjoyed this amazing and interesting presentation by our wonderful speaker. The link for registration and e-certificate is now being shared for school students and UMS students. Please fill in your details and answer the simple feedback questionnaire. All students will receive e-certificate while SDP point will be given to UMS students only. Thank you again to Prof. Nornazirah for the time to share with us, and thank you also to all the audience for your participation. We look forward to seeing you in the next 3S. Do not forget to follow us on Facebook and Instagram to keep you updated on the next session. It was a pleasure to have all of you with us on this beautiful day. With this, we conclude our webinar. Thank you for the cooperation and see you again.
Thank you.
Okay, thank you,
Bye.
Doctor.